The vIvA-Med system is a medical decision support system for screening/triage of COVID-19. It uses an artificial intelligence model to detect COVID-type lung diseases from the analysis of X-ray images and computed axial tomography scans. Next, we are going to show how to use the vIvA-Med application for premium advanced use for health establishments at an international level. Initially, the system opens with the URL page enables this menu of options, and when you are a new user, you must register by filling in the information requested in these fields: name, surname, document number, health facility, medical record number, and email. We select the register button to enter the system database that will be analyzed by the administrator to authorize the newly registered user to enter the platform. The administrator sends an email to the user to validate their data, and a new password is assigned. Once the user enters the system with his password to the system and enters the screen following where we inform him who we are and which institutions we're part of the development project. In the tab Use Model, you can find a brief description of how the medical inference model works. Later, it goes to this screen where the user can feed the knowledge base of our system and/or use the inference model to make the analysis from the available images of a patient. The system will consist of two sets of models for the segmentation, diagnosis, and detection of lung involvement. Models for lung segmentation will produce masks of two kinds at the pixel level of the images where the lung region area is detected and are used for image segmentation. The diagnostic model set will take the segmented X-ray and tomography images of each patient and will produce a binary diagnosis of COVID-19 compromise and probability of compromise. In the case of radiographs, this model will also provide us with the information on the location of lesions, such as a heat map from which a percentage of lesions is calculated. In the case of CT scans, a lung lesion segmentation model will produce pixel-level masks of images where patterns such as consolidations and ground glass are detected in the CT scans. The segmentations of the lesions of the patients will be transformed into normalized volume of the pulmonary involvement and used in conjunction with the volume of the parenchyma to calculate the percentage of lesion. In the Welcome tab to the vIvA-Med, you will find the following menu. In the Your Account tab, it corresponds to the user's personal information. Analysis history can search for images and/or previous analyses previously loaded into the system for your user. To facilitate the search, you can apply various filters such as date, hours, pathologies, and percentage of probability that the patient has the selected disease. In essence, this is the vIvA-Med project with which we hope to contribute and support health personnel in the early care of patients with respiratory diseases in the context of COVID-19, as well as a record and storage of information and diagnostic images for subsequent studies and scientific advances. Thanks.